So there have been a number of streams of work on the question of health equality, right? And health equality is really just the question of who gets to have good health and who doesn't. And we know in the city of Detroit, unfortunately, many of our minority communities suffer disproportionately high rates of diseases that are preventable. Things like infant mortality, things like obesity, things like homicide and violence. And so the question here that we want to ask and answer is how do we achieve an equity for health, that folks are having an equal access to the best kind of life, the healthiest kind of life. And we know that people are working on a number of different platforms. Some people are working in the community with the folks on the ground to try and advocate for good health and to build institutions around that. Some folks like me are working in public health departments and in government, try and build motion for public health. And other folks in academia are really thinking about what the latest and greatest, what do we know, and how can we use that. And unfortunately, sometimes I don't talk very much. And so the goal of this conference is to bring everybody under one roof to have a conversation about what we can contribute to this question and how we can solve it together. What is the pathway? What's the map, right? Who needs to do what, and how do we all come together to do that thing? It's sort of think about it like a choreography in a dance, right? It's like everybody sort of plays their own role, but we have to play those roles together in order for us to actually achieve something collective that we want to build. And so we know that folks have a lot of different ingredients that they bring to the table, and we want to make sure that we know how to add those to help us move forward. So what we want to do is produce a roadmap on key issues, and some of the ones that we'll be discussing today are access to resources, transportation as a key issue, physical activity as an issue, and what our food space and food environment look like as key issues. And so we know that these are areas where all of us have a different piece of the solution. We just want to bring them together and make it whole. We have representatives from a number of different community groups, and we knew that it's no good to talk about people, right? Everybody has to be a part of the conversation about themselves. And so we wanted community representatives, as well as academics, as well as public health officials, to come in the same room and to have these conversations, to dialogue, to chat it out. And so that's the effort here today. So we're not going to solve it all in one afternoon, unfortunately, but we know we want to kick off a conversation and we want to build relationships, because if we can do that, then we have a better chance of tackling it together. And so the hope is that we kick off a conversation, that we have a roadmap that we can follow, that we have relationships that have been seeded, that folks know each other and know what we bring to the table, and that as we move forward, we can start to tackle some of these problems in a really comprehensive kind of way. I talked a little bit in my comments about some of the challenges that uniquely are faced in Detroit. We've got a gigantic city, and unfortunately, employment numbers and income is not exactly what we'd like. But when you put folks who unfortunately don't have the means to really protect their own health in a space that's really, really big, pretty vacant, and that's really hard to get around, you now have the recipe for really, really hard challenges. Some of those are we suffer some of the highest infant mortality rates, the likelihood of a baby dying in its first year of life of any major city in the country. We know our violence rates are really, really high, and that's a public health issue. It's the #1 cause of death among young men in this city. We have really high asthma rates, and that has a lot to do with the quality of air and the quality of the spaces in which people live in the homes in the city of Detroit. Lead remains a really important issue, one that really is about the quality of homes, and we know older homes are more likely to cause lead poisoning. And so there are a number of issues that really we face here that we have to work on. And so the hope is that if we can seed a conversation between folks who have different parts of the solution, we're much more likely to get the solution together. And the key point is that the solution, unfortunately, is not going to happen tomorrow. But it's something that we're working together as a community, where we have community members, we have representatives of government, and we have academic leaders together in a room working this out, thinking about what the right approach to this looks like. What's the policy? What are the services that we need? What are the community activities that we need? How do we bring those all together and move this thing forward? So the health department is coming back. It went through challenging times during bankruptcy, and we're bringing it back. But one of the important ways for us to bring it back is to make sure that we're able to think about the strategy of really moving the conversation forward. And there are a lot of national leaders who have talked about how health departments need to be the lead community health strategist for communities like ours. And so helping to build a conversation, to move that conversation forward, to partner with like-minded institutions who are focused on challenges of health, groups like Wayne State, groups like a lot of the community groups that are here, and get us moving in a coordinated direction forward. That really is part and parcel of what a healthy health department should do. Yeah, so my parents are immigrants from Egypt, and they came in the late 70s they were choosing between going to Germany and Detroit, and they ultimately chose Detroit, and I'm so thankful for that. Detroit is a jewel in I think the crown of American cities, and unfortunately it's fallen on hard times, but we have the opportunity here to really capture that resilience of this city, and to start with health as a fundamental that all of us care about, and I see that as my role here. When I work with the mayor, it's very clear that he has a passion for public health, having been a CEO of one of the largest medical centers in the city, and when we sit down, it's fundamentally interested in how do we use health as a way to tackle the intergenerational transmission of poverty, right? How do we prevent the kind of poverty that happens in a particular generation to go to the next generation? To really tackle problems like teen pregnancy, like infant mortality, like lead, like asthma. These are the kinds of things that hold children back and keep them under circumstances that don't promote their health and in fact promote bad outcomes across the board. So that's the work that we're about, and to me, I'm deeply blessed to be here and to be able to be a part of helping to reestablish a fundamental agency in a community that I call home. As an Arab American guy, a lot of folks ask you where you're from, and for me, my answer has always been Detroit, and it'll always be Detroit. And to have the opportunity to come back after having spent some time away in grad school and to be a part of this is, I don't know what I'll go on and do the rest of my life. I hope to be here for quite a while, but whatever it is, it's not going to be as special to me as doing this job.